Hello, everyone. My name is Olivia Matongo, and I'm the Vice President of Programs for the Alzheimer's Association Illinois chapter. We are halfway through the Empowered Caregivers series, and we are so thankful for your viewership so far. If this is your first time with us, please be sure to catch the first two programs in the series. Today's program is Communicating Effectively, which teaches how dementia affects communication, including tips for communicating well with family, friends, and other healthcare professionals. I'm now handing it over to Annie Stahlfeld, who will guide us through today's content. Thank you.
Hello, and welcome to Communicating Effectively. Today's session is part of the Empowered Caregivers series, as mentioned by Olivia, and it's presented by the Alzheimer's Association. I'm Annie Stahlfeld, a community educator with the Illinois chapter of the Alzheimer's Association. I work a lot with the Chicago office. And my connection to the disease and why I volunteer is in honor of my grandma, who had Alzheimer's disease, but was really foundational to who I am as a person. And today's program is for caregivers who want to learn how to communicate well with the person living with dementia and how to respond to dementia-related behaviors. Today, we'll watch some videos of real caregivers. And if you have any questions, please leave them in the comments and we'll get back to you as soon as we can. So let's take a look at our learning objectives for today. After this program, you'll be able to explain how dementia affects a person's ability to communicate, describe how a person-centered approach can help with communication challenges, list strategies to help you communicate well with the person living with dementia, and identify ways to improve communication with family, friends, and healthcare professionals. To start, let's talk about communication. What is communication? Communication is how we tell people about our wants and needs. It's also how we share our thoughts, feelings, and ideas, and it's how we tell others who we are and connect with each other. Let's see what you already know about communication. Which one of the following are ways that people communicate? Talking and listening, attitude and tone of voice, facial expressions and body language, or all of the above? The answer is all of the above. Communication comes from our words, attitudes, and tone of voice. It also comes from our face and body movements, and communication includes listening, which can sometimes be even more important than talking. Now we'll explore how dementia affects communication. Alzheimer's and other dementias cause damage to brain cells. These brain changes affect memory, thinking, behavior, and communication skills. It is important to know that the disease causes these changes in communication. The person does not cause them. Communication changes are often the earliest sign of dementia. These changes can be different from person to person. Here are some common changes a person living with dementia may experience. Difficulty finding the right words, repeating familiar words, phrases, and stories, describing an item when they cannot think of the word for it, forgetting what they were talking about in the middle of a sentence, difficulty organizing words in a way that makes sense, speaking in their native language when it's no longer their main language, speaking less often, and using hand gestures more than speaking. We recommend a person-centered approach when communicating with the person you care for. Let's explore what that means. A person-centered approach means you use what you know about the person and adjust how you care for them and communicate with them based on their unique abilities and preferences. This approach can help you communicate effectively with someone living with dementia. Here are some ways you can use a person-centered approach when communicating with the person living with dementia. Always treat the person living with dementia with respect and dignity. Use your knowledge of the person's likes, dislikes, strengths, and communication preferences. Do they like to communicate verbally? Do they prefer to write things down? Call the person by their preferred name. Stay away from words like honey or sweetie or nicknames they may not like. If you don't know what the person would like you to call them, ask. Avoid talking about the person as if they're not there with you. People living with dementia want to feel included. This is especially true when the conversation is about them. Avoid correcting them. People living with dementia may say incorrect things. This is because of memory loss. Try not to correct or argue with them. Correcting or arguing only leads to frustration for both of you. And validate their feelings. Comfort the person if you see they're having a hard time communicating. Tell them it's okay to take their time. Many people living with dementia say that others do not include them in conversations, even when they're still able to participate. Friends or family may talk to the person's caregiver rather than directly to the person. When possible, include the person living with dementia in the conversation. It's important for them to share their thoughts and feelings with others and to feel valued. Here are a few tips for success. Talk directly to the person. It's helpful for both of you to be on the same physical level. For example, sit if they are sitting. Then you can communicate face to face. Speak slowly and clearly. This gives the person time to think about what you are saying. You may need to repeat parts of what others say. Use a calm tone of voice. It's helpful to speak calmly. Use a tone of voice that supports the meaning of your message. Acknowledge what the person says. If you ask the person a question, sometimes they may not directly answer it, or maybe they will say something unrelated to the topic, but it's still important to show that you heard them and welcome their thoughts to the conversation. Help them engage in meaningful conversation. Continue to talk with the person about topics that interest them. For example, maybe they like current events, entertainment, or family news. Be sure to change these topics if you need to. This can keep the conversation simple and positive. And have conversations about close family members or friends in your lives. Focus on your relationship with the person and talk about things you've done together. It's important to be patient and not rush the person living with dementia. Keep in mind that they may need extra time to think and decide what they want to say. Also, avoid interrupting. The person may need a little longer to communicate. Try not to speak for the person. Even if you know what the person wants to say, it is important to let them choose their own words and respond. Give them choices. You may want to tell them to do one thing because it's easy, but it's important to give the person options. Instead of, it's time to take a bath, say, would you prefer a bath or a shower? Choices help the person feel safe and in control. Connect in the moment. Talk about what is happening around you or how the person is feeling right now. Listen to what they have to say and respond in a way that shows you understand and care about their feelings. It's also important to try to limit distractions as much as possible. So find a quiet place to talk. Get rid of extra background noise and visual distractions. For example, turn down the volume on the TV or any music that's playing. Extra noise can make it difficult for the person living with dementia to hear and concentrate. Have one-on-one conversations. It can be hard for the person to follow and participate in a conversation when multiple people talk at the same time. Keep conversations simple. Ask one question at a time, or break down requests into easy-to-follow steps. Ask yes or no questions and limit the number of options you give. Turn off or turn down the sound on the television, and put away your phone so you can focus your attention on the person living with dementia. Nonverbal communication is a helpful way to deliver a message when you're trying to give the person living with dementia or an emotion you're trying to communicate. Here are some strategies to help you send and receive messages without using words. Use positive body language and facial expressions. Keep your body language relaxed. Use positive facial expressions as much as possible. Use hand gestures like pointing to an object. These visual cues can help the person understand what you are trying to tell them. Make eye contact. This is a great way to create or maintain a connection with the person. Use gentle physical contact. If you know the person likes physical contact, consider holding their hand while talking to them. You can also pat their arm to reassure or comfort them. Use touch, sights, sounds, smells, and tastes as other ways to communicate. So let's hear some caregivers talk about communication changes they experienced and what worked well for them.
Some of the changes I noticed in the middle stages with mom would be she would start to point to things versus saying them. So, for instance, she had a fascination for airplanes all her life. So we would be driving, and she would just, when she would see one, she would point to the sky, in the early stages, she would say things like, "Oh, the last one for the night that we see, the last airplane." And the middle stages, it was more just pointing. And so when that would happen, I would say, "Oh, there's the last one for the night, Mom," right? So I would be that voice for her at that point. I knew what she meant, and so then I tried to supplement it with some words myself, and then maybe she would actually repeat it or say, say something in regards to that. So then I knew she was engaged in that conversation.
When my husband was in the late stage of dementia, I would always sit and talk with him. I would try to use a calm tone of voice. I would always make eye contact, give him hugs, hold his hand. But sometimes it was hard for me to think of new things to tell him. I didn't know if my words were too complex. But one thing that we had always shared was a love of the Harry Potter books. And so I made sure that I always kept a Harry Potter book in his room. And sometimes a visit for us would be holding hands, and I would just read a chapter from a Harry Potter book. And that was actually really connective and important for us because as a couple, we had a lot of memories of reading those stories together. And I also was starting to read those stories with our son. So it felt like this way of making a family memory that I could hold on to and share with both my husband and our son.
So let's try an exercise to help you practice the tips we just discussed. I'll read a scenario and give you an opportunity to think about the best way to respond. Alonzo's wife, Alicia, is living with Alzheimer's disease and no longer able to get out of bed on her own. Prior to her diagnosis, she worked at an elementary school as a librarian. Alicia is no longer able to speak, and Alonzo is having a hard time communicating with her. This is making Alonzo feel less connected to Alicia. Based on this scenario, what do you think are the two best ways for Alonzo to communicate with Alicia and stay connected to her? 1. Hold Alicia's hand as he tells her what he did that day. 2. Put the radio on in Alicia's room. 3. Read one of Alicia's favorite books to her. Or 4. There's nothing Alonzo can do because Alicia can no longer speak. In this scenario, one good option would be for Alonzo to hold Alicia's hand as he tells her what he did that day. He could also read one of her favorite books to her. Alonzo should not put the radio on in Alicia's room instead of talking to her, or assume there's nothing he can do because she can no longer speak. There are still good ways for them to connect and communicate. As a caregiver, it's important to talk about your needs and the needs of the person living with dementia. Communicate these needs regularly with family members, friends, and healthcare professionals. This will help you build and strengthen your support network. Let's take a look at some tips for communicating with family, friends, and healthcare professionals. When communicating with family and friends, it's important to talk about your feelings, worries, and needs. Be open and honest. Do not be afraid to ask for help and support. It's okay to say what you need and tell people how they can help. Have difficult conversations when you need to. It can be hard to talk about topics like finances, disease progression, or end-of-life planning. However, these conversations are important. The earlier you discuss these topics, the more likely others are to support you when it's time for difficult decisions. Try to be patient with your family and friends. Give them time to be angry and sad. Validate what they are feeling and encourage them to talk about it. It takes strength to share these feelings. And stay connected. Make time to check in with others on a regular basis. These conversations will give you a chance to talk about other support you may need, which can change over time. To communicate well with healthcare professionals, it can be helpful to prepare for appointments. Learn about the diagnosis. Be ready to describe what you need. Have questions and documents ready. Do not be afraid to ask questions about the diagnosis, treatment plan, or available resources to support you. Explain the details. Make sure doctors or other healthcare professionals involved with the person's care understand that you are their caregiver. Be sure to share the most recent details about the person's health. All details are important. Take notes. Write down what you discussed during the appointment or ask the doctor if you can record the conversation with your phone. Then you can ask more questions later if you need to. Ask them to repeat or explain words or phrases when you do not understand. Your notes may also help prepare you for your next appointment. Ask if you can have a summary of the appointment. And think about your environment. If the doctor is speaking to you in a busy waiting room, or if you're in an area that's too loud for you or the person living with dementia, ask to move to a quieter room or area to make it easier to communicate. Whether you're looking for additional ideas to communicate more effectively or have other questions about topics we haven't covered today, know that the Alzheimer's Association is here for you. We provide a wide variety of information and support, including our free 24/7 helpline that can connect you with highly trained and knowledgeable staff in over 200 languages. They can help you with education and decision-making support. They can help during a crisis, and they can also help you find resources. Master's level clinicians are available all day and night. They can give detailed care consultations, a free of charge care navigation service. Families can use it at any stage of the disease. We also offer many local resources. Find your Alzheimer's Association chapter at alz.org/findus. We offer local support groups for caregivers, people living with Alzheimer's, and others facing the disease. Some groups are led by professionals, and others are led by specially trained caregivers just like you. The Alzheimer's Association and AARP Community Resource Finder at alz.org/crf is a database of dementia and aging-related resources. It is an online tool that can help you find programs and services in your area. Our website, alz.org, has free information and resources for people facing Alzheimer's and other dementias. alz.org/care has information for caregivers. alz.org/safety and alz.org/driving offer information on staying safe at home and how to know when it is time for the person to stop driving. ALZ Connected at alz.org/ALZ Connected is a free online community for people living with dementia and their caregivers. And ALZ Navigator at alz.org/ALZ Navigator is another interactive online tool. You answer questions about your situation, and then it makes a plan just for you. The plan includes information, support, and local resources. We offer a number of education programs like the one you've attended today. These programs can help you learn more about the disease and various caregiving topics. We have free in-person, online, and virtual programs. That's the end of today's session. Thank you so much for watching, and if you have any questions, please leave them in the comments and we'll get back to you as soon as we can.